So we're going to welcome Jason onto the show now. Jason Lynch is a therapist. He's an addiction therapist, and we're going to talk to him. Welcome, Jason. It's great to have you here.
It's great to be here. I appreciate you not only having me, but this forum for people to learn about addiction in families.
You had a chance to listen to Sean. Is there anything about what he said that stands out to you?
A great deal. It's a story that I hear from a lot of patients that I work with. So we know, multi-generational addiction is very common. When we look at addiction, we think of it as a biopsychosocial disease. And so what that means is there's a biological component, which in addiction we think is about 60%, 60% of it being genetic, 40% of it being other factors. And so, someone who has a direct blood relative, that being a parent or a grandparent with an addiction, they're actually four times more likely than the average person to also develop an addiction. So there's definitely a genetic component that we see play through from generation to generation. And then, certainly some of the factors that Sean talked about, the psycho social part of the disease, being kind of what's my psychological makeup? How well have I been taught? How well has it been modeled for me to deal with adversity, to deal with difficult situations when they happen? Do I have the coping skills? And then that social part of what's my support system around me? Do I have a quote unquote healthy or normal family where I have a lot of support, or is there addiction in my family and therefore some of those things are lacking? So a lot of what Sean talked about definitely rings true.
So one of the questions that somebody in the audience had is, is it usual or unusual for substance abuse and addiction to run from generation to generation? And also, you touched on the genetic component as well as the environmental component too.
Yeah, absolutely. So we do see it quite frequently. As I said, someone being four times more likely than an average population. And we know that from looking at twin studies. So if you have twins who are obviously identical twins, so they've got the same genetic makeup, but for whatever reason, they don't grow up in the same household, we look at, how likely are they being separated if one grows up in a family of alcoholics and addicts, and the other one grows up in a family without addiction. We were able to see that despite that kind of nature versus nurture debate, you're still much more likely to develop an addiction by having that genetic piece. So certainly we see it as something that's very common from generation to generation. As Sean was talking about, that can be very scary for a parent who has an addiction, thinking about, is my child going to have an addiction as well? And even though that genetic component is so strong, one thing that we know about that does mitigate that risk is for a child to see their parent in recovery. So one of the very few things that can really reduce that risk is a parent talking about their recovery, sharing their recovery with the child, and that is one thing that can lower that risk for the subsequent generation.
I'm thinking about Sean's kids. They're 15 and 12 years old now, and they've been exposed to their parents' drug use and the life, so to speak, since they were young, very young children. And yes, Sean mentioned that he and his wife have been very honest with them, and yes, the kids go to counseling. But at the same time, I would imagine that they're highly susceptible to addiction.
Absolutely. From not only having a parent who is has an addiction, but also from maybe some of the things that they have encountered or lived with growing up. Now it sounds like Sean, despite and his wife, despite having the addiction, always tried to take great care of their family. But one of the things, just as an example, that Sean talked about was the impact that some of his trauma had on him. For him, it was sexual abuse, and we know that people who have trauma develop PTSD. They're at an increased risk for developing an addiction as a way of kind of dealing with that trauma. And so, a child who may grow up in a household where there is abuse or neglect from a parent who has a substance use disorder, that child kind of picks up on some of those patterns as well. And may, when they experiment with drugs and alcohol early on, find that it numbs them, and so later return to drugs and alcohol as a way of dealing with the trauma or that history of abuse.
Carla, who's watching the show, says, "I always wonder if it was my fault that one of my children has an addiction and the other doesn't." And she says, of course, she wished neither did. Um, is it the parents' fault?
Absolutely not. Um, I think there's a lot of factors that go into whether or not someone develops an addiction. Frequently parents assume blame for a lot of things that happen to their child, but it's not as simple as being able to attribute to blame to a parent, and that's something a lot of parents have to work through. Is understanding that there's three C's in Al-Anon. One is I didn't cause my loved one's addiction or my child's addiction. I can't control their addiction, and I can't cure it. And so, really, that first one of knowing that they're not the cause is important.
So before we wrap up the show, I want to ask you this question: if addiction, and this I think would be very helpful to a lot of people who are watching the show today, if addiction runs in your family, what should people be aware of?
I think the one thing that you should be aware of is looking for signs that an addiction may be developing. So, in a child or a young adult, you may see that person become more isolated. You may notice some behaviors that are new. They may be pulling away from their peer group. You may notice them being, possibly even under the influence around you. And I think for someone who's an adult, being able to notice some of those same things in themselves. So if I am now pulling away from family and friends and not participating in, Thanksgiving and Christmas like I used to, if I have developed an increased tolerance, that is one sign that someone may be kind of crossing that bridge from what was abuse to dependence. And then certainly any kind of withdrawal symptoms if they stop using, feeling the effects of that. Those can all be signs. And certainly a big one that often people face is negative consequences. So if I am losing jobs because of my substance use, if I have been picked up for a DUI, if my spouse or my significant other is pulling away or threatening to leave, those would be signs that you would want to seek professional evaluation to determine if it really is a substance use disorder.
Jason, thanks so much for being with us today. We appreciate it.
Absolutely, thank you.